and welcome to another insightful episode of MedSynapse podcast series. I'm Hetvi Shah, your host, and today we are diving into a critical topic that touches the lives of many: breast cancer surgery. Did you know that breast cancer is one of the most common cancers affecting women worldwide? And the surgical options can significantly impact not just the survival but also the quality of life. And to explain this, today we are honored to have with us Dr. Radhika Kapahtia, a renowned plastic surgeon specializing in cancer reconstruction. With over 14 years of extensive experience, Dr. Radhika has been at the forefront of combining oncological reconstructive surgery to help patients reclaim their lives post cancer. She is currently associated with Cancer Hospital and has a remarkable career that spans across multiple cities in India. So, welcome, doctor, and thank you so much for joining us today.
Thank you. That was a very generous, introduction from your side. I'm really obliged. Thank you.
Thank you, doctor, and we are so eager to learn from your vast experience.
Definitely.
Yeah. So let's start with the basics, doctor. So oncoplastic surgery is a term that not everyone may be familiar with. So could you explain what oncoplastic surgery entails and how it integrates oncological and plastic surgery techniques for breast reconstruction?
Okay, so the name itself, it suggests that onco and plastic. So onco basically means cancer and plastic is obviously plastic and reconstructive surgery. So we are basically combining these procedures. Now, whenever there is a tumor, obviously if the patient comes at the right stage, at the right time, then we are able to offer them that yes, this can be removed from your body. And after that, it leaves a scar. I mean, it leaves a big, a defect, which we call in our medical terms. It has to be resurfaced. Okay, so the application of plastic surgery in oncology basically is called as oncoplastic surgery.
Understood. That actually highlights the point also. So now moving forward, one of the big decisions patient faces is the time of reconstruction. So could you discuss the pros and cons of immediate versus delayed breast reconstruction, and how do you determine what is the best option for each patient?
Okay, so the timing of reconstruction, yes, in breast cancer surgeries, it can be chosen by the patient whether they want to get immediately reconstructed or it can also be a delayed reconstruction. Okay, so in immediate reconstruction, basically what is being done is that the oncosurgeon, they will remove the breast and after that we have to reconstruct it in the same go. Now this removal of breast can be either a breast conserving surgery wherein a part of breast will be left behind if the tumor is small, and if the oncological surgeon, they feel that it can be done. There are many ifs and buts. I think some oncologists will be able to put more light on that, this particular topic, that which cases are suitable for breast conserving surgery. If breast conserving surgery is not done, then they remove the entire breast. Okay, so basically immediate breast reconstruction will be that I am going to put a flap immediately in the same go during the same surgery itself, so that the patient wakes up with a new breast. Okay, and in delayed reconstruction, basically you are just closing that area from where the breast will be removed. It will be closed primarily, like it will be a flat chested area, it will just be closed, and later, after the completion of their entire treatment, see, surgery sometimes is just not the end of surgery. These people, they undergo chemotherapy, they undergo radiation and all that. So you have to give it time so that they are completing all that, and they have to be disease free for a period of at least of 6 months, and after that we can offer them reconstruction. Okay, now if you ask me which is ideal, I would say that it is immediate breast reconstruction, doing everything in one go. Okay, because reconstructing the patient and making a new breast, it has nothing to do with tumor. Okay, many people come and ask that will it hamper my further treatment? No, it will not hamper your further treatment. It will not give any, it will not cause any basically a delay in your further treatment. In fact, in one go, you will be able to make a new breast also, and also your tissue planes will be good. The blood vessels which will be used for making the breast reconstruction using microvascular reconstructive surgery, wherein free flaps are used to reconstruct the entire breast. They will be virgin, there will be good planes. It will be easier for me and also easier for the patient. Okay, but whereas if the patient is coming later after radiation, suppose now patient has undergone radiation, they waited for 6 months, suddenly they thought that I wanted to get my breast reconstructed that time. No, but I think it can be done now also. Yes, it can definitely can be done, I'm not denying it, but it is going to be a little difficult because radiation causes a lot of damage to the tissue. So the planes will not be good, the requirement of the flap will be more, the blood vessels might give a problem, and the chances of having morbidity is more, like in delayed reconstruction compared to immediate breast reconstruction.
Yes, that is actually very true. I think when it is going on everything with the treatment, you can actually go for
Yeah.
the
So many
reconstruction
patients,
of
they,
it.
they think they start giving a second thought that first let us get rid of the cancer,
Mhm.
let us, it's a human psychology. I mean, everyone wants that only, that we should be treated first. But then no one foresees the future. Now, these days in breast cancer surgery, so much of advancement is there that they have long life expectancy. So reconstruction, basically, you have to tell them that it you have to think beyond cancer. Okay, that you have to see yourself, you have to imagine yourself that you're going to survive for another 20, 30, 40 years, whatever. And later, having like not having a very important part of your tissue, a female body, how it is distinguished from a male body, one of the main area is the breast, and if we lose it, if it is flat chested, then you cannot wear good clothes. Everyone wants to good look good, like everyone wants to look good these days, and they want to wear good clothes. And breast has an important role to play in maintaining the femininity of a female, correct? And every day when they're taking bath, they see that scar on their chest and it is flat chested, it reminds them of the disease, and that's how they go into a psychological trauma and depression. And they lose confidence to go back into the
Mhm.
society. These days all women are working, no one is sitting at home, correct? So they have to go and meet multiple people. If they are in IT sectors, if they are doctors also for that matter, they have to meet so many people in a day, so many meetings. Even though you're working from home, you have to feel good about yourself. So that is what is breast reconstruction all about, correct?
Absolutely, it actually gives you so much confidence also. It
Yeah.
helps you gain confidence.
Yeah.
So now when it comes to actual reconstruction techniques, as you also mentioned that there are several options available today. So could you walk us through the most common techniques used in breast reconstruction and how you decide which method is the most suitable for each patient?
Okay. So, I also do reconstructions in head and neck cancers. But in head and neck cancers, basically, it is mandatory. You just cannot escape without, doing reconstruction in them. It is life saving. Okay. But in breast reconstruction, it is a choice. Like how we discussed about immediate and delayed. So we give the patient that particular option, that whether they want to get reconstructed now or, later. And also the beauty of breast reconstruction is that there are multiple options available which one can use to reconstruct the new breast. And in this particular scenario of breast reconstruction, the patient themselves, they can walk us through their choice, and they can themselves decide that what they want. Okay, so it is like a platter, and they can choose whatever they want to have from it. So commonly used options are from the tummy, okay, and from the back, and also from the buttock, from the thigh. And then, of course, there are breast implants and tissue expanders which are available. Okay, so broadly, if we categorize breast reconstruction, we can divide it into two types. Like whatever I do as a plastic surgeon, it is called as a flap. So, flap is basically a tissue which has got its own blood supply. Okay, now flaps also can be divided into two types. One is a pedicled flap and one is a free flap. Okay, in a pedicled flap, basically I will take tissue from somewhere else, like I'll take tissue from a back. Imagine I will just make a tunnel in the axilla in your armpit, and then that particular flap will come and sit in the area of the breast. That's it. Okay, it is having its own blood supply. Its blood supply comes from a blood vessel, which is in your armpit, and that is how it will be. Okay, now in free flap, what I will do is that basically it's like whenever we are sitting, we have this extra tissue hanging in our tummy, that particular tire which we have. Okay, so that basically is being used to reconstruct a new breast. How it is done? Like I will see that how much it is coming after doing a pinch test, that whatever tissue is extra, I will be using that, and that particular area, including the skin, the extra fat which is there, I will dissect it along with the blood vessels. Okay, so I will take blood vessels in that particular tissue. So basically, it is like a transplant only. Like how in kidney transplant, liver transplant, the blood vessels are taken, the organ is taken, and then later we use it for putting it in someone else's body. Here we are utilizing our own extra body tissue for reconstruction of the breast. Now suppose if this tissue is in my hand, now it doesn't have a blood supply because I've already cut the blood vessels. Now what I'll have to do is that I'll have to join the blood vessels of the abdomen to the blood vessels of the chest wall. So in chest wall, basically there are multiple options available where I can use the blood vessels. Generally, I prefer taking it from below the rib. So a small piece of rib is removed and those blood vessels are exposed, and we join the blood vessels of the tummy to the blood vessels of the chest, so that this particular piece of tissue, which is going to be the new breast, is independent and have got its own blood supply. Okay, so later even if they need radiation, since this tissue is very vascular, it has got its own blood supply, it is able to sustain the radiation also. Okay, so one is from the back, that is a pedicled flap. One is from the tummy, it is a free flap. Even from the buttock, we can use a free flap, as in we will take extra chunk of the tissue which is there in the buttock, and the love handles which are there just above the buttock, that also can be used, and blood vessels can be taken, and a new breast can be reconstructed also from the thigh. Again, this depends on the body habitus of the patient. If the patient is very thin, okay, like you, then I won't be able to get anything much from the abdomen. Okay, then I will go to some other options which are available depending on how your body is. So we know our body the best. So in fact, patients can tell us that, okay, you take tissue from my tummy, it is very much extra, and later the another good part about this will be that the tummy also will become fat. Many people, they pay money to get abdominoplasties, so that they can have a flat tummy and they can look good and have a contour to their waist and all. Everything is included in this basically. So it is like a good package wherein your breast also is getting reconstructed, your tummy will also get flat and everything, and you can wake up happily without even having thought that you have lost one important part of your body.
That was actually very interesting and informative. So now let's just talk about the long-term outcomes of this surgery. So how do you typically see a patient who have undergone breast reconstruction, and how do you monitor these outcomes over time?
Okay, so like I said, in free flap, we have to monitor because they have joined the blood vessels here. So we have to constantly monitor that how that particular blood circulation is going on in that tissue. Okay, and also since we have taken tissue from the tummy, the recovery period, I would say, in this kind of tissue where it has been taken from the abdomen. So it is also called as DIEP flap in medical terms. It is deep inferior epigastric artery perforator based flap. Okay, so in these cases, basically, I would say the recovery time is around 4 weeks. For 4 weeks, they can walk and all from the first day itself, but no heavy weight lifting and all. And by 4 weeks, they'll be absolutely normal. And in long term, if I say, if everything goes well, then generally they don't face any issues. Sometimes what happens is that these patients, they come back, they say that, the opposite side breast is ptotic, because that is the normal breast tissue, so it is little sagging down, then the new one which is created. So that time we can offer them the other side reduction and procedures which will make the other breast also taut, and it will bring in symmetry. Now these procedures can also be done in the same go. Okay, if you feel that the size of the other breast is very huge and it is not matching properly, then you can ask them that if they wish to have this, then other breast also can be reduced in the same go, and all the symmetrical procedures can also be done in the same go. Okay, so once they are disease free for 6 months after radiation, we can also offer them that they can make a nipple. Okay, and this is not a very big surgery also. It can be done under local anesthesia as a daycare procedure, and later tattooing can be done for the areola part also. 3D tattooing these days, everything is like super advanced, and everything can be offered to these patients, and slowly as the time goes, they can experience having a near normal breast. And long term side effects, I would not say there is anything much. I mean, if 4 weeks period everything goes smoothly, then I don't think there is any problem with the back. But the back area also, like I told you, we can do a pedicle flap, and that also similar protocol we follow. If they say that they are not happy with the symmetry of the breast, then we offer them that you get the other breast operated, and they can have reduction procedures and all also. And like also I would like to highlight here that reduction mammoplasty is a procedure wherein the size of the breast can be reduced. Now it is not just for looking good, no, it goes way beyond that. Why? Because if your breast is heavy, these females, they keep experiences chronic shoulder pains, chronic neck pains. They keep going to the orthopedic surgeons or neurosurgeons that they are having a pain, but lastly they realize that, oh, it is because of my heavy breast. And the moment the breast size is reduced, all these aches and pains, they go away. So it has also got a functional aspect to it. You see, it is not just about cosmetic surgery, it is way beyond that. It is functional also. So yeah, this is the whole thing about it.
Yes, actually, it is so rightly said that it is not just cosmetics. A lot of aspects come into picture.
Yeah.
So now educating the right way is another aspect that we cannot overlook, especially in breast reconstruction. So what role does patient education play in the success of breast reconstruction? And how can doctors better support their patients in making informed decisions?
Okay, so see, this is a very good question. I really want to tell everyone, whoever is watching this podcast, that nothing should stop you from getting your breast reconstructed. If you want it, you should go for it, and I think you should go for it. In Western countries, I suppose they don't even give you an option that whether you want to get reconstructed or not. It is just mastectomy plus reconstruction. It is never a choice unless and until the patient's general condition itself is not allowing for this long surgeries. Okay, so with that, basically whenever a patient has a tumor, they go to the oncosurgeon. So oncosurgeon is the first phase which the patient sees. Mm-hmm. So basically oncosurgeons, I think they should promote their patient. Like in our hospital, we ask everyone if they want to get reconstructed, and in our hospital we do breast reconstructions on regular basis, all like for breast conserving surgery also, and for total mastectomy wherein the entire breast is removed also. So we follow this protocol, we stick to the protocol. We have multiple pamphlets which we have kept in the OPD, so whoever is going to the breast OPD, they'll get to see this pamphlet in which we have described the procedures and what are the benefits of getting reconstructed. That can be done. Secondly, these days the good thing is that many celebrities are coming out that they have this disease. We will start with Angelina Jolie herself. She is BRCA positive, so she has gotten both her breasts reconstructed, right? So like we all have mentality that we try to follow what celebrities do. So like that, even I think Mahima Chaudhary, and recently I think Hina Khan also, they Tahira Kashyap, they all have come out and they have told about having the cancer, fighting it, and also they have, all of them have gotten their breast reconstructed, I believe. So this is another thing, and of course the podcasts like what you are doing, they will also create awareness. And in all the conferences and everything, we always promote that yes, reconstruction should be done.
Absolutely. I think right kind of awareness also matters from the right source. So, yes.
Correct. Correct. I think in October somewhere, when there is a breast cancer week also, there is one day which is specifically dedicated to breast reconstruction awareness day. I'm not sure about the date, but yes, such kind of day is also there. So all these activities will slowly, bring in awareness. Although also the patients themselves, they can tell, they can come out and tell that, like how these celebrities have done. All of the patients who have undergone cancer surgery, who are still surviving, they are all warriors. Okay, so they themselves, they can tell their story of the triumph. And in our hospital, we also, what we do is that we have support groups, like patients who have undergone breast surgery and reconstruction. We make sure that they meet once a month, all of them who have been operated and who are going to be operated, so they can communicate themselves. The patients who have already been operated can tell their experience to the patients who are going to get operated. And a lot of anxiety like comes down when they actually interact. They just don't feel that they are not suffering with this alone. There are many people who have gone through this and who are victorious, and they are now living a normal life. They are working, they are CEOs of big companies and whatnot. So this is also a good way of like increasing awareness about breast reconstruction.
No, it is actually a very good initiative, I would say. So now one last question before we wrap up is, how do you address the concerns of body image and self-esteem that many patients struggle with after breast cancer surgery?
After breast cancer surgery, if they have been reconstructed, I would say I don't see them facing these issues. They are happy, even like after doing surgeries, whenever there is a gap of 3 to 4 weeks between starting chemotherapy and radiation therapy, I see many females, they start work. So if they undergo breast reconstruction, I'm sure that they will not face these kind of issues. But yes, if unfortunately due to many reasons, if they have not opted for breast reconstruction, and they come after 6 months of radiation or chemotherapy after disease-free interval, and they come and talk to me, they have always a regret that they did not do at that time. Okay, because they were scared. So this has to come out. And ultimately, if you are not feeling good about yourself, like I've told you before, then your confidence goes for a toss. It affects you psychologically, and then you're not happy, and it's like a vicious cycle. We all know, we all have been through this. So that's it. I mean, people who undergo reconstruction, I don't see them facing these kind of issues. In fact, they are more happy, and everything is done in just one go. And happiness also about not getting one more surgery again, going under the knife also is not there. So I think people who get reconstructed, they are more happier than the ones who are not, maybe.
That is actually very good to hear also. So as we wrap up today's session, I will actually like to thank Dr. Radhika for sharing your expertise and insights with us today. And let me tell you that this conversation has truly shed light on multifaceted nature of breast cancer surgery. So thank you so much, Doctor, for sharing your insights with us.
Thank you for giving me this opportunity. Thank you very much.
Thank you. And to our listeners, remember, early detection and awareness are key in fighting against breast cancer. So let's keep spreading awareness and a word to all of you. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and spread awareness. Thank you.